Hi everyone, welcome to PharmaGrid. So let's continue with the quick review series. I can assure you that whatever the points I have included in this series will be really helpful for your revision, especially for those who are preparing for any kind of pharmacy competitive exams. Okay, so let's start. Phosphate binding is likely to occur when which of the following antacids are administered? Here the answer is aluminum hydroxide. The reason is that aluminum hydroxide reacts with phosphate ion in the intestine to form aluminum phosphate, which is insoluble, and it will be eliminated in feces. This may be of value in treating hyperphosphatemia in patients with chronic renal failure. Next point, ibuprofen and oxaprozin, both are non-steroidal anti-inflammatory drugs, should be avoided in patients who are sensitive to aspirin because of possible cross-sensitivity reactions. Oxymetazoline, xylometazoline, both are nasal decongestants, have longer duration of action, about 8 to 12 hours. Phenylephrine, nafazoline, tetrahydrozoline, all these are nasal decongestants having short duration of action. Iron primarily absorbed in the duodenum and jejunum by an active transport. Ferrous salts of iron are absorbed better than ferric forms. Regular insulin is clear so that it can be administered as subcutaneous or intravenous injection. Fluvastatin belongs to statins or otherwise known as HMG coenzyme reductase inhibitors belongs to pregnancy category X. Desmopressin can be given intranasally for primary nocturnal enuresis treatment. Scopolamine, transdermal patch dosage form for prevention of nausea and vomiting associated with the motion sickness. This transdermal patch is applied to the skin behind the ear at least 4 hours before the antiemetic effect is required. Drug is released from the transdermal product for 3 days. Next point is gastric intrinsic factor, which is a glycoprotein required for the gastrointestinal absorption of cyanocobalamin, which is also known as vitamin B12. Latanoprost is a prostaglandin F2 alpha analog used for the treatment of glaucoma. Haloperidol is a butyrophenone antipsychotic. Tamoxifen is a selective estrogen receptor modulator. Permethrin is a topical scabicide and a pediculocide. Acetaminophen has analgesic and antipyretic action similar to aspirin but lack anti-inflammatory activity because it does not inhibit peripheral prostaglandin synthesis. This acetaminophen does not inhibit platelet function or prothrombin time. Didenosine is a reverse transcriptase inhibitor. Main adverse effects include peripheral neuropathy, pancreatitis. Dactinomycin and plicamycin are anti-neoplastic agents classified as antibiotics. They exert their action or their cytotoxic effect is by interfering with the DNA and RNA synthesis. Carbon monoxide when inhaled and carried to blood reacts with hemoglobin forms carboxyhemoglobin, which will reduce the oxygen carrying capacity of blood. Deferoxamine mesylate is an antidote for acute iron poisoning. It is a chelating agent. It has got high affinity for ferric iron. Acetazolamide alkalinizes the urine and sodium bicarbonate directly alkalinizes the urine. So thank you everyone. Thank you for watching this video. Please stay tuned for more videos.